something that we wanted to discuss, and we may do it after the presentation, but we wanted to reiterate, I'll speak for Jackie, but we wanted to reiterate that this is a community group, and that although a lot of the presenters have come through NAMI, that we are eager and excited to have other organizations come up with presenters or suggestions for future agendas. We certainly don't want everyone to think that NAMI is the only one that can provide presenters. And we really, truly want to make sure that that message gets out, that this is a community collaboration, and we want to hear from different organizations of what they're doing, and or have them find presenters that they feel are important for the island and our mission. Okay, so why don't, even though we did a brief introduction, I will call on each of you, and for the purposes of Gosnold and their representation here, let's let them know who we are. I'll start. My name is Kevin Marshall. I work for the police department. I'm also the chair for this committee advisory group. Sue?
I'm Sue Mintonen. I am the Director of Substance Misuse and Addiction Prevention for NAMI on Nantucket.
Thank you. Suzanne?
Hi, Suzanne Franzuto, Program Coordinator for NAMI on Nantucket and Facilitator for Behavioral Health Advisory Group.
Margaretta?
She's on the phone.
Sorry. Carrie?
I'm Carrie Bridges. I am the Director of Communications and Community Engagement for A Safe Place here on Nantucket.
Bint?
Bint Rostad, and I am an aunt of an individual who's involved in both DMH and Gosnold. And interested citizen. No, and just very interested in behavioral health and helping move things forward.
Thank you. Jacob?
Hi, good afternoon. Jacob Stapleton, the Community Engagement and Education Coordinator for Children's Cove, the Child Advocacy Center for Cape Cod and the Islands.
Susan? Oh, I'm sorry, Susan. There you go.
There's all these Susans and Suzannes. Am I?
Yep, go ahead.
Yep, we can hear you.
You can hear me. Okay. I have a son who has schizophrenia and various other things. I'm at St. Paul's here on Nantucket as a deacon, and I have a mental health ministry in Delaware, and I work with NAMI.
Excellent. I didn't know that. Thank you.
Okay.
Dawn?
Hi, I'm Dawn Hines. I'm an eating disorder specialist and recently founded an eating disorder network specifically for the Cape and Islands, helping to get people connected to treatment.
Thank you. Margaretta?
Hi, sorry, I'm alone in the office today.
No worries.
Margaretta Andrews, Executive Director of the Community Foundation.
Thanks. Jackie?
Jackie Lane, Executive Director of NAMI Cape Cod and the Islands.
Thank you. And I see that Michael just came on. We're just doing introductions.
Hi, everyone. Can you hear me?
Yes.
It's Michael Kellerman, Interim Executive Director at Fairwinds.
Awesome. Thanks. So I did want to update the group. As you know, we did, I don't want to say celebrate, but we recognized May as Mental Health Awareness Month. And we did have that proclamation signed and acknowledged by the select board. I was able to, or we as a group collectively were able to disseminate several yard signs, which I have since collected. Stop and Shop was able to have that table set up, and I wanted to thank Sue and Suzanne for monitoring that, and anyone else who may have done that. Stop and Shop manager was thoroughly impressed with the information that was on it. She was very excited that we approached them to do that, and so that did make us look good. And I did go onto the website to say, or to see how the stats were, and they significantly went up. We had over 30 people go onto the website all around this area or Cape Cod. And so I think that it was a good idea. I think we need to continue to do things like that to allow people to recognize that we're here, that there is help, where to go for help. And so I think that that was money worth spent. So kudos to all of us, and let's do something different next time. The signs have been collected and they're being held somewhere, NAMI, so we can use them again next year. They don't have a specific date on them. Okay, so we do have two presenters. We have Kevin Ralph, who is the Chief Development Officer. See, I did shorten your title. Chief Development Officer from Gosnold, speaking about the SOAP program that NAMI is collaborating with. And I will let Jackie do the introduction from there.
We are collaborating with Gosnold, and we have heard so many times that they needed to have programs on the island, and it's always very difficult to do that, especially during COVID. So with this collaboration, when what I call the pot money, which is the marijuana tax money, became available, we reached out to Gosnold to see if they would like to do a partnership with us to try to not only publicize and market the idea that we had to deal with addiction and drug misuse on the island, but that we had to have some very on-island services. So we were very fortunate that after a strict review, the money was granted. I believe the final would have been at town meeting on last Saturday. And so with that, I thought that it would be very good to have Gosnold here to give everyone the details of exactly what this program is going to be, and also a bit of an overview on what Gosnold does and what we hope will be more services on the island. So Kevin, if you want to start off.
Sure.
Hey, Sue, we sent you the PowerPoint. Do you want to give us hosting ability, or do you want to pull the PowerPoint up?
Sorry, I'm on mute. I will give you permission.
Okay.
Which you should have now.
All right. Oops, let me get to the other way.
All right.
Wait. No, not yet.
All right, well, I can, everyone can hear me, I hope. Yes, okay, good. Oh, hi everyone, it's, I know I've had the opportunity to meet or speak with a few of you, and it's great to meet those of you I haven't had the chance to yet. Again, thanks for the introduction, Kevin. My name is Kevin Ralph, Chief Development External Relations Officer at Gosnold. I've been at Gosnold now for since last October. So I'm still in my first year here. So new to Gosnold, not new to the Cape or the industry. I was with Cape Cod Healthcare for 4 years as the head of the foundation there, and have been doing development work and external relations work for about 26 years now in higher ed and healthcare phenomenally. So it's great to be at Gosnold and again to be with you all. First couple slides, really just a quick refresher on Gosnold. I'm sure you probably don't need it, but just to give you a quick overview on what what we're doing. Obviously, folks think of us in terms of addiction, in terms of treatment and recovery, and about 50% of our business is actually is behavioral health care, right, outside of the addiction space. But we know how many people battle co-occurring disorders, and about 84% of individuals with addiction are also battling with behavioral health issues. So again, that's something that's not new to any of you, but the focus of our mission, of course. Next slide, just again, another quick overview. The reason I brought this up is we're actually coming up, 2022 is going to be our 50th anniversary of Gosnold's founding. So we're going to be planning some more awareness initiatives around that, and also We're really excited. I mean, for me coming on board, to really re-energize the relationships that we have on Nantucket. And that's true across all the organization, but also specifically from our senior leadership team, which I sit on. So we really have a commitment to Nantucket, and we're looking at all. We're going to specifically talk about soap today, but and I'm going to turn that over to Erin in a minute. But I just wanted to make sure that a quick overview of all of our operations to start off with. So on the inpatient side, we have the 35 detox beds in Falmouth. In Catalan, we have 57 rehab beds. You can see all the stats that relate to the outpatient and inpatient and outpatient services. And Erin, who's our outpatient director, is going to fill you some more on that as well, since that's her area of specialty. But as everyone else here, we can skip to the next page. The challenge, without reading this, I don't think it's anything again that you're not already aware of. But not only the opioid epidemic, but addiction in general is having a massive impact on our region. Just in, obviously we've seen tremendous spikes during COVID as well. Our beds are rarely if ever empty. They're always in demand. So one of the big things that we're going to be tackling in the future as well is how can we create better access to our services, and that takes a lot. It's not just a one tactic that we have to implement, but the need is out there, and we're here to help fill that void and fill that need. And it's important for us to collaborate like we do with Jackie and NAMI on this very specific opportunity. We think there's a lot more out there for us to do. And please, if you have any questions, feel free to jump in and ask at any point. And we also left a couple minutes at the end for questions too. So, but now specifically, so we can move on to Nantucket and what we're doing there, and I'll turn it over to Erin for this piece.
Hi, my name is Erin Russell. As Kevin said, outpatient director for Centerville, Nantucket, and Falmouth outpatient sites. As you guys all know, we do have an office on Nantucket at 35 Old South Road, and we currently are hiring for clinicians on Nantucket, but we currently have one outpatient clinician, and then we have Brian Frascati, who does primary emergency service subcontract that we have with Bay Cove. Nantucket is, as Kevin was saying, supported by a larger organization that has inpatient services. We are able to utilize those services if we have a patient that needs a higher level of care or additional support that can be provided through telehealth or in person, depending on the service. We have an electronic medical record, Evolve is the name of it, which is linked into our EMR, so that if someone has additional services in another part of Gosnold, we're able to collaborate and coordinate care. And again, we have access to those for our patients on Nantucket. Some of the current services that we have for the community on Nantucket, we have as I was saying, the subcontract through Bay Cove Human Services for emergency services. Currently, we are offering offering it in person and telehealth, depending on the day and time. That's a bonus of COVID, I would say, is that we are able to offer some additional services, including our SOAP service, which is a Structured Outpatient Addiction Program. I'll get into it more of the in-person Nantucket, but we currently can offer that through telehealth in our partial hospitalization program, which is out of the Centerville office. Our Structured Outpatient SOAP program is primary diagnosis of substance misuse disorder, and our partial hospitalization is dual diagnosis with a primary of mental health diagnosis. We also offer individual couples family counseling in person and telehealth on Nantucket. We with the one clinician. They can't access obviously everyone, but we have accessed and helped out through telehealth to our other outpatient sites. We have medication management that's currently offered by telehealth due to COVID, and that's provides psychiatric medication to adults. And lastly, we have the family support group, which is a weekly family support group offered to family members that have someone that is struggling with substance misuse or struggling with mental health. It's a support group. It is anonymous. You can show up, you can take it all in, or you can communicate and build that network. And right now it is being provided by Zoom, but we do have it in person at our site when hopefully we can get back to there soon. So specifically with the grant that we partnered with NAMI, we are hoping to offer an in-person structured outpatient addiction program, which we call SOAP. It's also been called half-day IOP. So it is a program, a group program that is offered for between 3 to 5 days a week, half day, 3.5 hours of group programming. And it is a step down program from either a higher level, someone stepping down from our detox or any detox, or a residential level of care, or it's a step up program, which offers people that might be an individual and need a higher level of care instead of going from individual to detox. We're hoping to catch those people that might just need a little bit more support, and they can get that through the SOAP program. So in the SOAP program, it's a structured day program. You get an intake with a clinician when you start the program, go over a biopsychosocial, go over what the treatment goals are for that individual person, and then you would attend groups. So there's 3 groups throughout the day. First, there's a check-in to check in, see how everyone is doing. And then there's a psychoeducation part of it, usually, and then there's intervention. So they utilize the education that they use, and the group will support each other to in activities or group conversation to get that education. They also, in the SOAP program, offer individual sessions. So if someone's having a hard time, they can meet with a counselor, clinician, case manager to discuss their goals individually. If they need a higher level of care, if they need additional support, then that clinician can help and support them to try to get those services in place. Usually an average length of stay for SOAP, insurance companies will support 20 sessions, and they're required at least 3 days a week to go. And also throughout the SOAP program, we offer weekly drug screenings to support the patient. It's an intervention to support them, to hold people accountable, to see where they're at, to see if they needed a higher level of care or a lower level of care. And then lastly, the last part of the SOAP group is the discharge planning, which begins at intake, but at discharge, we talk about what steps come next. What do they need after they have successfully completed the SOAP program? Oh, I already went over that, sorry, should have gone. And this just goes on that we do have a telemedicine equipment at our site on Nantucket, so they could utilize additional services when they're there. They could have a med appointment or additional support with a counselor at one of our other sites off Nantucket, and then we'll go over the aftercare planning. These are some of the skills that they'll learn throughout the SOAP program: recovery management, relapse prevention. They'll learn about post-acute withdrawal syndrome, the 12-step orientation, if it's AA, NA, refuge recovery, any one of those 12-step programs. It doesn't focus on 12-step, but it's part of of the program so people that it's helpful for will be able to learn about that and connect to that community. They learn about the neurobiology of addiction, and then we also talk about medication-assisted treatment. If they need it, if that's something that they're interested in, we'll help and set them up with those appointments going forward. That's about it.
And I should just mention also, obviously we're talking about the in-person piece, but if there is, I mean, I know it's not really possible to do if anything positive came out of COVID, right? But telemedicine has been so important for us, and we were in a position, a year ago in March where we were able to basically move our telehealth services pretty seamlessly in terms of the delivery models. So we were in a good position there. Obviously, the government and has taken a kinder stance in terms of reimbursement rates and other red tape around the telehealth process. But I also think now, a year and a couple months later, the counselors, not just here but in general, are getting better and better at navigating the telehealth world. That's obviously a big difference than being in person. I'm stating the obvious, but that was really key. While we're all we're more than anxious to get back to in-person care delivery, telehealth was really worth a mention there in terms of its importance to the organization.
Yeah, and I think that just to add to that, telehealth has really helped us decrease our no-show rate. If someone even has an appointment in person and they either are running late or they forgot about the appointment, the clinician's able to reach out and support that patient where they're at and get them in for that session. So it really has helped with the no-show rate and keeping patients engaged in treatment. It has been helpful. But I think the reason that, or one of the reasons, continue the partnership with NAMI to have SOAP on Nantucket is because we realize that in-person or telehealth is not for everyone, and in-person for the community can be helpful and beneficial for people that need that support and need that community, and it's an added level of support to keep people out of detox level care, to keep people in their community and in their home where they feel safe and like they, it's right there. They don't have to go far. So I think this would be a great resource for Nantucket.
Michael?
Hi, Erin and Kevin and Jackie.
Hi.
I wanted to ask about how, because you have experience with these programs in other geographies, how these integrate back into the community. And so, like, how do other partners, you can imagine Nantucket might be Fairwinds, or it could be the hospital, it could be Addiction Solutions or others. How do other partners get integrated into the care model? Is it more within the program or as part of a step down sort of handoff part of that? Because this certainly would be an exciting addition to the continuum on island. So I'm just curious how that integrates.
Yeah, I think that in a couple ways they can refer to this service. So having those referrals to patients at other agencies that need the additional support. And once referred, if the patient is okay with collaborating and signing a release, that's a continued collaboration throughout the whole course of treatment. So just keeping it, the clinician would be able to keep in contact with other it be a primary care, an individual therapist, or a recovery coach that can be part of that treatment. Because I think that's what we know is best in treatment, is having everyone on the same page and everyone towards the same goal. So I think, and then definitely, like you said, at discharge planning is definitely the referring source, or the other agencies involved are going to be key in that piece.
Does it tend to accordion based on the needs of the client, or is there like an average sort of participation in an IOP like this, like in terms of the length of care?
Like length of stay per patient?
Like stay, but it's in the community. So yeah, I'm trying to wrap my head around.
Yeah. So usually between 12 and 20 sessions is average. But that can be broken up into 2 months, right? Because they're only going 3 days a week, depending on need, but it's definitely individualized.
Thank you.
Question. Can I ask a question? I got a quick question.
Go ahead, Carrie.
So just to add on to Michael's question there. So do you collaborate at all specifically with Dr. Lepre and Addiction Solutions? Do you work together, or do you simply refer to your clients here on island to him? Or is there another, does your physician here at Gosnold, can he handle that medication assisted treatment post addiction issue?
We would definitely collaborate with Dr. Lepre. Our prescriber and Dr. Lepre and Addiction Solutions talk on a weekly basis. So it's definitely a collaboration. I can't speak to what our prescriber prescribes. I mean, there's some medication that he can prescribe. There's some medication that he can't, that has to go through Addiction Solutions, but it's definitely an ongoing collaboration with them.
Great. All right, second question. Do you, talking about your telehealth and your emergency services, with the new protocols from United Healthcare, do you know how that's going to affect your teleservices in the emergency room? Because I understand that their plan is they will not be covering a large portion of telehealth services that are performed in the emergency room as of July 1st.
So we only have the Bay Cove contract through a Mass Health Insurance. Okay. So the hospital actually will cover those commercial evaluations.
Okay.
Yeah. Obviously, if someone calls our emergency services and needs support to get to the hospital, we would help them with that. We wouldn't say, no, we don't cover that, but we would help them get to the hospital where the hospital would be providing that evaluation.
Okay, great.
That's a contract through the insurance. Yeah.
Go ahead, Margareta.
A quick question about staffing. I know that it's been a challenge in the last couple of years.
Yeah.
What are your thoughts about how best to recruit? I mean, I think that in person, at some point, we all have to kind of get back to that model, and that has been a challenge for Gosnold. What are your thoughts about that?
Yeah, I would agree. It's definitely a challenge. Staffing is our #1 challenge on. And it's not just in Nantucket. You know, our wait lists on Cape are pretty significant. So I think Kevin can speak to the marketing. We're trying to offer a competitive salary so that we can get someone in. And so I think we need the community too. We need community support to, you know, that's how people, or one way people find jobs, right, is word of mouth. So I think that's part of it, but Kevin can definitely speak to the marketing piece.
No, absolutely. We're very active in terms of recruiting right now. But I'm sure it's not a surprise to anyone that, you know, we're facing staffing challenges in a lot of different areas here, whether it's on the clinical side with nursing. You know, we're sitting here almost in Hyannis, right? So Cape Cod Hospital, I mean, I know this healthcare system, everyone's looking for nurses, just as an example, right? And I'm sure, you know, we all hear about how many openings there are in other industries and other sectors as well. So it's, you know, it's definitely a challenge. We're being aggressive with our advertising, our recruitment, offering sign-on bonuses. So, you know, we're looking to push this very aggressively and proactively.
Well, I don't know what the heck it's, you know, I mean, is there anything?
I have a question. It's Holly.
Holly, go ahead.
So I have a question about probation. I was wondering if you will, or if you have reached out to the probate officer here on Nantucket, and if you'll be able to work with the system here to divert people who need help to the SOAP program.
Kevin can speak to if we've reached out to them yet, but I can tell you that on our in our other sites, we work closely with probation. We have met with our probation departments. They understand our services and they refer a lot of diversion cases to SOAP or our partial hospitalization. We also have a contract with federal probation where they do refer to these services. But Kevin can speak to if we've reached out yet.
Yeah, actually, I can't speak to it because I'm not sure. So, but that is something I'll take back with me. And if we haven't yet, we will. It's a great point. Thank you.
Thank you.
I have a question. So I know the grant funding is available starting July 1st. Do you have a target date of when you will start SOAP on Nantucket?
I think a lot of that depends on staffing, right? We have to get someone, I mean, we have SOAP in other sites. So it's training the person on Nantucket. It is hiring someone. The program is ready to go. We do this every day in our other sites. So I don't think we don't have to develop a program. We don't have to put it in our EMR. It's already there. I think it's just the big piece, like Margareta said, is staffing, is getting someone to be able to do it. Yeah. And then marketing and having the community know it's there and have people participate.
Mommy will definitely take part in the marketing piece.
Right.
Absolutely.
Right. Our goal is to have this running by September 1, if not sooner. So, I mean, the program is going to, as Erin said, the program is running. It's a matter of taking it to another level here with the in-person piece.
Right. That's that's exactly like that. I'm just trying to get to like, what's the timeline? How do we, and how can we help?
Right.
Find a place for somebody to live.
Yeah, I know.
I have a shed.
I don't know, September might be a little easier than July and August, but I'm not so sure.
Yeah.
I have another question.
Yeah.
A lot of us are obviously hiring and we're seeing lots of names cross our desks. Can you help me understand the kind of profile you're looking for this type of person? Because a lot of people come across our desks and we're like, oh man, I wish we did that level of work or that type of work because this sounds like a great candidate. And as we're looking for it, we might as well push folks your way. So I'm just trying to wrap my head around it since Fairwind's just doing a ton of hiring at all times at this point. So
yeah, that would be great. So it is a master's level clinician. Okay. Substance abuse experience would be great. But I think, just work some behavioral health experience and have a master's level experience, group experience if they've worked with groups, and just, being an independent worker. We're, like we've said many times, there's a whole agency behind that, but it is a boat ride away. So, some independence is good, but working part of a team, and having those leadership skills. Thank you, though. That's very.
And so it doesn't require a certain type of licensure, but you're looking for a licensed master's level, or does it have
they
to
don't
be
necessarily have to be licensed. They could have master's level.
Okay. Thank you.
I should just point out one other thing. We're talking about collaboration and looking at the future. We expect to collaborate more with other organizations and partner organizations as we move forward. My team at Gosnold, we're on the lookout just from a funding perspective on a literally daily basis from government opportunities, private foundations, individual donors, and a lot of times in terms of the actual program or care delivery models, funders want to see collaboration. They want to see what the impact is that you're having on a community. So, I would love to be able to keep those communication lines open between us. And if and when, I should say, when something comes across my desk that makes sense, I'd love to be able to reach out to folks who are part of this meeting now and put our heads together to see what we might be able to accomplish. And if any of you have needs or questions that we might be able to help with, along the same lines, please, I hope you'll feel free to reach out to me too.
Well, this is one of the reasons that we have this group.
Right.
It started out as a task force of behavioral health providers on Nantucket Island. And if you keep up with these meetings, which we have been having once a month, and also the list of people that are members, that's a very good way to stay in touch. And then I think, I don't know if you're aware, but right now we're going through a very special community needs assessment process on the island, looking at what a continuum of care and mental health would look like on Nantucket and how to get there. And so this is a time when collaboration, cooperation is key. And hopefully through this process, a lot of people will get to know each other better and how they can help each other and work together. At least that's what I see as one of the people that's up there as part of the organization of this effort.
Jackie, that's a good segue into any updates.
I just have one more slide. So I just wanted to put this, if anyone needs to refer, that's our number. And then there's the mobile crisis number.
Awesome. Erin and Kevin, thank you very much for putting this on. I would echo what Margareta said as far as worrying about staffing. I think it's not the program that we're questioning. I think it sounds like an amazing program, but at one of your very first few slides, you had telehealth. And so I'm wondering how many clients do you actually see in person? And if this program will ever be able to be launched due to the staffing level that you're at. So, but I think our concerns have already been mentioned a few times.
No, we're definitely definitely aware, and we're after it right now. So yeah, we hope to get this moving really, really quickly.
I don't know, Kevin, they made a commitment to me.
Well, I say, it takes a village, and whether it's telehealth or in person, I think that any help that we can provide the community is better than nothing. But I know we're all trying, so I appreciate it. Jackie, you had mentioned the community assessment. Did you want to update, or Michael, did you want to update?
Michael might want to, or Margareta. I've been kind of among the missing for a couple of weeks. I've been taking some personal time, so I think they might be better to do it, but it's the idea that we want to have a lot of involvement. So Michael, Margareta?
I think Michael offered, but it looks like he might be offline. So I can update. The steering committee was created. I think it's 12, 13 members, community leaders, providers. They met about 3 weeks ago and got some great feedback. The consultants got some great feedback from them. We also have a broader group of what they're calling an advisory committee or an advisory group, which are, again, clinicians, members of the community that have access services, clients and patients who have access services. So that wasn't quite as well attended as we understand. They have 4 meetings scheduled throughout the summer. The next one, I believe, I see why.
Sorry, my child is going through a diaper change in the background, but I think I'm blocking him.
Can't wait to see. Can't wait to see. But that's a broader group. And the next meeting, I believe, is June 24th. And so we're making every effort to ensure that good, broad participation. We need as many voices in this conversation as we can get. So that is all I have to say. Michael, anything?
I was just going to say the thing that I think is the sort of the secret sauce of this model for assessment is having a broad set of conversations to get insights from across the community, but then overlapping and overlaying that with the data that's provided to sometimes back up and sometimes actually challenge some of those narratives. So before going into any sort of solutions phase, mapping out the gaps on the island and what we have and what works and what doesn't and why really is that interplay between voice and data. And so I knew the limits of my role as executive that was new. And what I'm most excited about for Fairwinds is that Christy Wilson and Amanda Wright are part of this advisory group, really helping drive the data and have those conversations. I believe they're having more conversations at this point than I am with GPS about how things work. So I just wanted to really promote that. I think this group is a really exciting group to be part of. And we, of course, would like to see more people involved than have thus far, but we also know that it's iterative. And so this next round, hopefully there'll be more conversation. But I just wanted to say a little bit about the model, and I know Dawn.
Yeah, no, it's great. The next step is a survey. There are going to be 2 different surveys sent out, one to providers and one to community members. And when we get to the community member part of that, we'll be reaching out to everyone included in here and everybody on this list to share that link. Again, as many voices as we possibly can get within
That'll
that.
be in English, Spanish, and Portuguese. I believe no more than those 3 at this point, but at least
at this point there hasn't, yeah, we haven't identified. And I thank Michael for his clinicians who are going to be translating that, because there are some things that are not really clinical, but they're a little more than just the average translation. So thank you, Fairwinds, for doing that for us.
Happy to.
Both. Dawn had a question.
Yes, hi. I was just wondering if I could have access to the link or how I can potentially be a part of that June 24th meeting.
If you send your information to me, Dawn, at mandrews@cfnan.org, I can send that along to the consultants.
Okay, can you share the email again? I'm sorry.
Sure, it's mandrews@cf, as in Frank, nan.org.
Okay, thank you so much. I appreciate it.
Yep.
Did Gosnold have anything further? Kevin?
No, I don't think so.
Okay. So we're a little early, which is perfectly fine. I just wanted to make sure that if anyone had any updates for their own organizations that they wanted to mention during this forum, that now would be the time. Jacob.
Hi, everybody. Quite a few things, but I'll try to make them quick. So first, save the date. Our Champions for Children conference is back on this fall, and we are going to be doing it virtually. And so that's going to be October 21st. I will put, once I'm done talking, because I can't multitask that much, I'll put the web address for our conference website in. It is going to be virtual. It is 1 full day. However, we are making it at no cost for participants of our multidisciplinary team and community partners. So because it is virtual, we want to make sure that we're getting as many people in. There's a lot more opportunity for, say, frontline staff or those who maybe wouldn't have been able to come over to the mainland to attend a 2-day conference. There's still going to be some great content there. So we have our full speaker list up and outlined. So again, I'll put that link in shortly. We are now fully open and we're still working off of a hybrid model for work. However, you will start seeing me out in person. I am now cleared to go back out into the community. And so I have 15 months of being pent up behind a desk and computer. So I'm about to take everybody by storm. So I'm ready to go. And I have about 9 trainings lined up between the Cape and the islands right now. So I'm excited to go and keep doing that. So if you know of anybody who is looking for any type of update, training, education, just for me to come by, please let me know. Feel free to reach out. And much like many other organizations, we are going to be hiring. We don't have that up yet. Look sometime in the next week and a half-ish, and we will be hiring for 3 positions. We will be having a family services coordinator coming on, a CSEC case manager / forensic interviewer, and we are also going to be hiring for a pediatric sexual assault nurse examiner. And that's actually through the Department of Public Health, so DPH, so that's going to be a separate link. But all of that stuff will be up on our website very soon, so just so you all know. So that's the long and short of it, and I'll start typing up that link in a moment.
Thanks, Jacob. Anyone else with any updates from their organization?
I have
Michael?
one quick.
Oh, sorry. Go ahead, Don.
Sorry. So I have one quick one. I'm part of the Cape and Islands Family Support Network, again, focusing on eating disorders, but also work with clients who struggle with a number of mental health issues. And we recently started a listserv. So the purpose is really just to share. I know you already have such a coordinated communication network, but if anyone is interested in posting anything or sharing information or conferences, fundraising events, I'd be more than happy to post that through all of the people that are on the listserv. So you can just email me. I'll put my email address in there. And this, hopefully the list will grow and grow as time goes on. But again, it's specifically just for the Cape and Islands and sharing about mental health resources and training initiatives for the community.
Awesome. Thank you, Dawn. Michael, you had something?
Yeah, just a quick 20 Vesper Lane update. Sunny's not on, is she? She's not here, right, today? So Health Imperatives has been back in the space, but they just they're in the process of getting a refresh inside and out. So there'll be some structural improvements and just some beautification there. Alcoholics Anonymous will be returning to a full schedule of meetings at the space, actually including in the backyard, where we have collaborated on putting up a tent that would be the preferred space in good weather for meeting. We're this close to coming up with a return schedule. It just has to do with getting everything settled. And then Fairwind's intentions are to return to the office for those that are on island on July 6th. And so there'll be some plans coming out for that as well. Something to wrap everyone's head around is that we do have some telehealth only clinicians. And depending upon where he is, our medical director is sometimes telehealth, sometimes not. And so we imagine that will continue to be a hybrid model as we move forward, but there will be that really coveted and important opportunity for in-person therapy for those that want it. And based on capacity, clearly for those that are on island on our therapy side. So we're excited to be taking that step.
Excellent, thank you. Jackie or Erin? I'm not sure who's raising their hand. No one? Oh, you lit up, sorry. Anyone else? Any updates? Jackie, did you have anything to close the meeting out with, or?
I just wanted to say thank you to all of you that helped to sponsor the publicity campaign for May being Mental Health Awareness Month. I think it was a great effort on the island. And I honestly think we've come a long ways in the last few years of making mental health part of the conversation, an important part of the healthcare conversation on Nantucket. And hopefully with this assessment process, we will continue to do that. And Nantucket has a chance to be a model for things because it's a small self-contained community with all kinds of diversity. And it would be a wonderful place to set up a good model. And I think the first part was bringing mental health and addiction out of the closet. And I think that the work that all of you did for putting up signs and posters and negotiating with townspeople was really great. And thank you for that.
Excellent, thanks, Jackie. All right, that's it. I appreciate everyone's time. Thank you to Gosnold for joining us.
Thank you very much. Thanks for having us.
Have a great rest of the week.
Thank you.
Bye, everybody. Thank you, Kevin.
Bye.
Bye-bye.